Welcome to Elevate Care. I'm your host, Kerry Perez, and I am joined here today with Cathy Henesey, who is VP of Talent Acquisition at Advent Health. Cathy, welcome to the show.
Thank you.
So tell us a little bit more about your role. I also know you were past president of the Association of Talent Acquisition Professionals, been in the industry for 20 plus years. Tell us a little bit more about you and Advent Health.
Okay, great. Yeah, happy to be here. Thank you, Kerry. I've been with the organization for 9 years now. I actually started in Chicago under a joint venture with Ascension. I was there for 3 years and then moved to Orlando to work out of the corporate headquarters and lead the talent acquisition function. So my team's about 250 people. We're a centralized team, but geographically dispersed across 9 states. So about 250 team members. We hire a little over 27,000 external new hires, and then we process about 9,000 internal movements to promote promotions and opportunities across the system. So roughly about 36,000 hires.
Big team. Thanks again for coming. So I guess let's just start with talking about, you've been in the industry for 20 years, a lot of expertise. What are some significant changes that you've seen in healthcare and in your profession?
I think healthcare, I've had the opportunity to work in other industries. I've worked in IT and manufacturing, and then I got into healthcare in the last 12 years. And that biggest change that I see, or really seeing that, is that transformation of the need to do candidate attraction. I think I think healthcare probably didn't have that difficult time to find candidates. Maybe 20 years ago, it was just a profession either you went into or didn't, and there seemed to be abundant candidates. But just as in all companies experience, as baby boomers started to retire, there's more competition. The internet certainly exposed everybody to more jobs. That just increased the competition for healthcare. And so that's a real mind shift for leaders who had never thought that they needed to recruit people, right? Like, we're Advent Health. Everybody wants to join us. But then we started experiencing competition. And so that need for that talent attraction strategy has really become imminent in the last 5 years. And of course, COVID just catapulted that too, that need to have more and more talent.
Yeah, speaking of that, COVID, of course, the theme on everybody's lips is talking about staffing levels. It was, unsustainable during COVID. Can you give us a little bit more about the state of the union today? Have staffing levels sort of returned to normal? Is there a new normal? What gaps exist?
Yeah, it's a great question. So I would tell you, I just feel like we got to new normal in January. As we still worked through 23, there was just lots of residual continued, high volume with just different pockets of the country. And so getting off of the use of high travelers from COVID and getting them back to just where we're at a normal staffing. So while COVID was over, we still had that high number of patients and just the long-term effects of that. I really felt like the beginning of 24 really started to feel normal again. And so we seem to be at regular patient census, although you're hearing pockets of COVID coming up here and there. But so something we continue to monitor. But now it just feels like we're in normal, whether we have summer seasonal flu or, pockets of increased patients in certain hospitals. It does feel like it's back to normal.
Well, that's good to hear, because the not normal was very hard for everyone. So let's
Absolutely.
now start kind of pivoting into, your expertise with strategies and planning for talent acquisition. Talk a little bit about maybe how we're thinking about short-term or long-term strategies with sourcing, acquiring, and retaining candidates.
Sure. So for short term, I think the real strategy has moved to almost all social media strategies. That wasn't the case in healthcare, and healthcare tended to lag in that strategy, 10 to 15 years ago. But now they are definitely the same, operating at the same operational level of our Fortune 100 companies, and doing social media strategy and being able to tell that story. That's what's great about healthcare is we have so many compelling, great, heartwarming stories. We have now learned how to take those stories and turn them into, the ability to show our culture and our values and really put that to, a picture and a video to attract candidates and say, why do you want to work here? So for short term, I think that's definitely continued to take advantage of those strategies and get out in the marketplace. We've also seen a surgence of kind of in-person events, as we call them, either hiring events, expos. During COVID, those were non-existent. And even before COVID, I think companies got out of the habit of doing those. Well, once COVID was over, and people wanted to start to get out and meet people, we kind of brought those hiring events back. And I think those will be our new normal. We continue to do things like walk-in Wednesdays at our hospitals where you can just come in. You don't need an application, you don't need anything. Just come in and talk to us. And then just hosting specialized hiring events, whether we focus on nurses or maybe surgical employees, just different events that we can cater to our needs of that specific location. Long term, we really have to look at early talent development. With the baby boomers retiring, the next generation and that generation after that is not going to be enough to replace what is needed in healthcare. Because what people don't think about is like, oh yeah, baby boomers are retiring. But what you don't think about is they're retiring to a place where they're going to be 70 years old and need additional healthcare. So you've got this large population that we've never had before that is going to be, if you really look at the next 30 years, as they turn 70, they're going to need care and they're living longer, right? And if they live to 100 years old, we're talking about 30 years worth of care of the largest population that we ever need. So we need more people in healthcare than ever before. And so hospitals have to really now think about getting in at high school level, junior level, to introduce healthcare roles to them. And, beyond, do you want to be a nurse or a doctor when you grow up? How about a radiology technology? Or what do you want to be a digital media strategist? You can be a high level accountant, or, you can be in HR. There's so many functions that are in a hospital. We have to do a good job of going out and introducing those roles to high school students that may have never thought about the healthcare industry.
And so do you think there has been some gap of that education to that population before? Was there a material shift where people were very interested in the profession, maybe lost interest? Maybe a little bit more about that.
Sure. I think what I have found is that healthcare is definitely generational. If your mom or dad was a nurse or a doctor or, in the healthcare profession, we see generations coming behind them that they entered into healthcare as well. So they got that opportunity to see that. And so we have many family members that work together. And I think before that was probably enough to populate our needs. But that is not going to be enough going forward. So we really need to go out and just do a general education about healthcare. And so you think about at the high school level, you have maybe 4-H for agriculture. There are IT and STEM programs for high schools that have been long in existence that IT companies helped fuel and support long ago. You just don't see those healthcare programs. And so we're starting to see our competitors, maybe in their markets, maybe create like a magnet school for healthcare or some type of magnet vocational school where they can get introduced into that at an early age. And we're even thinking, working at, we normally had not hired somebody that could work at 16 years old, but we're trying to find opportunities where they can come in and get introduced to healthcare and then wait till they, work in other areas. Maybe they could work in patient registration or, food service, and then get introduced into those clinical roles when they're 18.
Mm-hmm. Makes sense. You mentioned social media earlier. What seems to resonate the most? You kind of hinted at talking about culture, talking about sort of the human stories. What are you seeing resonating maybe with that new group of potential candidates?
Yeah, it's not only just the stories themselves, but the newer population coming right out of high school and your college generation really care about, I think they care about two things: sustainability and what is your organization, and then the purpose of your organization, right? What is it that you do, right? It's they care about who they work for, and they care about what are you doing to sustain the world and sustain the market and reuse things. And so we have a new team that is just focusing on sustainability. Our corporate headquarters is going all solar, which is really amazing. And we're really spending effort looking at the efficiencies of all of our hospitals and the way they are run and what is our own carbon footprint. And then we certainly will talk about that and share that. And our most recent corporate building was built to the green standards. And so it's highly efficient and it's just gorgeous. And all seemed all glass, but run at such a high efficiency level that it got those efficiency ratings. So I think that they look for that sustainability, and then the purpose, of course, the purpose being serving our patients. And we are faith-based, so we do a lot of mission work as well in foreign countries and in the U.S., really giving back to the community. So we focus on those community efforts, and we encourage our own employees to volunteer on those efforts and go help. I just had some recent recruiters who one of them had to be a nurse as well. Just went to the Dominican Republic to help build facilities for them so that they can offer and serve more patients. We have a big mission trip in Kentucky. So it's really just being able to show them that our commitment to that patient goes beyond just those that walk through our hospital. And we're really out there in the community and servicing them at different health events, providing nurses and doing those checkups on site and with churches.
Love that. And so you and I both know it's not just about getting people in the door, but it's also about keeping them there. Talk a little
Yes.
bit about retention strategies.
Absolutely. That is something that also probably wasn't thought of that much, 20 years ago. And because people stay in healthcare, but now they know there's so many more choices and they get exposure to the choices. You're right in that we have to really put that attention to retention. So some of our newest initiatives is really making sure that we're providing them a long-term career path. For nurses, we have a clinical path, a clinical ladder for them to upskill, learn new specialties, be able to keep up with the market and their own skills, and so that they can go down a different path. We have all kinds of tuition education programs where they don't even have to put out money anymore, that those can be direct billed to us so that they can further their education. But then we're looking at those programs where that entry-level person who maybe is working the front line as a greeter at a hospital can work for us while they go to school, and then they can continue to, if they would like to go be a nurse, if they want to be a surgeon, whatever that looks like for them, they can go to vocational school and become a surgical tech. They can work for us and take advantage of those programs, which really lends to that retention, but also just our values. And that helps with retention immensely.
This question is maybe a little bit tactical, but I'm kind of a data person. So I'm just interested through the acquisition as well as retention, what sort of key metrics do you look at to know that you're, doing well?
Oh, well, that's definitely my sweet spot. We in talent acquisition, we measure over 60 different metrics, really from start to finish, from the time that the candidate even express interest. For example, we know that a candidate, before they ever apply, touch or see us at least 8 to 12 times. So they may see us on an ad, or they see us in a retarget ad, or different places that they touch and see Advent Health before they actually apply. And so from there, it's really measuring each step of the process for them all the way through to the point that they actually start. For talent acquisition, it goes up to that start, and then HR picks up their onboarding experience and then the retention for them afterward. They have additional metrics. We'll do like 90-day surveys and yearly surveys to gauge how are they feeling as employees, and relate that to additional skill sets and things that we can provide to them. So there's great attention to looking at the metrics and understanding the why, what is happening. And particularly we look at shifts in metrics. The big if there's something happening in a particular market. Is there a high turnover in a particular department? Why is that happening? So we have our HRS team created an awesome, what they call like a heat map, which they took a great amount of time to study all the reasons why people leave and what might be happening before they leave. Are they applying for a large number of jobs internally? Have they called the help desk and wanted to know about changes in benefits, or all these different things that kind of play into somebody, what might lead them to want to resign. And so they measured what are those triggers, if you will, that might lead to that, did they do well on their evaluation? And so that they can measure, this might be a person. It will produce a high risk list to a hiring manager to say, this might be a person that might be looking. How many times have they applied on an internal job? We have those frequent appliers. And if somebody's applying to 30 jobs in the last month to go move somewhere else, clearly something is happening. And so we pay a lot of attention to those triggers.
So just comparing notes, is there like a long pole in the tent as part of the process, getting people credentialed? I know, at least on our end, collecting all those documents and making sure they're ready to go. That is probably a long part of the process. Is there a known sort of bottleneck in your funnel?
Gosh, that's a great question. This is something we've actually recently studied on. How long does it take once they accept the offer to when they actually start? And there's several different companies that offer benchmarks out there, and ours has been a little bit longer than the benchmark. And what we found is, particularly in Florida, which is our largest population of employees, we're having a high number of people relocate to Florida. So that time they ask to relocate, on average, has been 68 days from the time that they accept to the time that they start. Which, of course, the background check and everything happens during that time frame, but just the act of moving. So we found that really kind of extends that time to onboard, and which is okay. That is what it is. I think other than that, we have really worked to make that process efficient for the candidate and being able to get through that background check. And we do an employee health appointment, and just to make sure that they're fit for it, that they qualify for the position, and depending on what their position requires. And we do a drug test as well.
Great. And last, maybe detail question. It's kind of your own curiosity. We know there's bringing new leads into the door, but you've also probably amassed a big database. Do you have a sort of database kind of maximization sort of strategy as well?
That's a good question. We do have well over 2 million candidates in our applicant tracking system, and we are very mindful of that database, and consider that every candidate is still a candidate, no longer how long ago they applied. We're using a new tool. We don't necessarily purge them, but we are using a new tool. It's an artificial intelligence tool that helps us go into our applicant tracking system and select those candidates, just kind of weed through those candidates faster. And so brings up the candidates based on our requisition. It finds the most qualified candidates. We'll still post it and still attract new candidates, but we really want to take advantage of the candidates that we already have and then send out messaging to them to introduce them to, hey, we have a new position. Looks like you applied 6 months ago to a similar role. We have a new one. Would you like to be considered for this role? And that has really proven effective in introducing them. And even if it's not that job that they applied for, what we find is they're like, oh, well, let me take a look again at Advent Health. And they go in and find a different job. And we can track that. What did we send the message for? What did they end up applying for? And of course, what did they get hired for? So we're really taking advantage of this tool to use our current sources that we already have.
Yeah, I mean, because it costs money to bring people into the door, and it's definitely a treasure trove. So thanks for letting me go off script. I know we didn't really talk about that at all in our pre-call, but we're also seeing some shifts in preferences from our candidates, how they like to work, flexibility, gig economy type of stuff. What are you seeing, A, that they're interested in, and then B, are hospitals sort of prepared to be able to meet those preferences?
Hey, Kerry, it's a great question to think about. This is where we've had to go back to our executives who have been used to the normal, schedules and everything works the way it used to work, where nurses work on 3 12-hour shifts and, they're used to that kind of model. We have had to come and educate them to say, listen, the newer generations really want a lot of flexibility in hours. And we learned that during COVID, particularly as we just went to the marketplace and said, hey, if you can't work for us full time, we went back and asked employees that worked for us in the past, maybe they had already retired, maybe they were students, different things that said, you tell us what shift you want to work and we'll make it happen. And that's a little easier to do during COVID, but we knew that kicked off that, and it was there already as a groundswell that candidates, employees are looking for that flexibility to have a more work-life balance for them. They want to spend time with their children. They want to go to the school programs, and maybe, for those that work on the weekends and do different things, that they are asking us, maybe they don't want to work 3 12 hours. Maybe they want to work 4 8-hour days, right? Maybe they only want to work part-time if their children are at school from 9 to 3. We as an industry, it's not just our system, but as an industry really need to challenge our technology to be able to adapt to that type of scheduling. And then we really have to challenge our leaders to make sure that we develop different processes so that makes it seamless to a patient, right? So you think about, if you're a patient, that if they change shifts every 12 hours, you get a new nurse, right? Or new staff. If you're shortening that time, let's say just even to 8 hours, so that becomes 3 shifts a day. And so then you have to make sure that you're really educating employees and making sure those handoffs are really for the best patient care. Mm-hmm. And so that's a challenge. That's a little bit more education, a little bit more handoffs. And so and then technology, making sure our technology can do that. And so we're seeing that with the newer generation, yes, money's important. I'll be competitive, but what's more important is the more flexibility you can give me, the more that I'm going to be attracted to your position. Mm-hmm. We're also seeing then that as trend towards being able to be paid more frequently than just every 2 weeks. And again, that's a technology to be able to work with your payroll and be able to do that. And I see companies more and more moving to that. And we're definitely investigating what could that look like, and what would that require from not only our staff, but our banks and our technology to do that. They just want that just in time pay, if you will.
Right. And with that flexibility where maybe somebody doesn't want to work those 3 12s, or they just don't want to work that full work week, does that mean that you need to acquire more candidates? Does that mean more staffing?
Yeah, it can, for sure. I think about, I've, introduced that as a potential opportunity as, nurses that are retiring, and if they're, mostly if they're a baby boomer now, they're starting to be in their 60s, they may not want to work 12-hour shifts. That's a long shift to be on your feet, but doesn't mean they want to retire completely. So we have to think about, so if they're willing to do 8 hours, then that means 3 people a shift, or a 24-hour time frame instead of 2. So yes, we would definitely have to hire more people that might do either less shifts or more frequent shifts, right? Mm-hmm. And so we need to think about that from a technology standpoint and scheduling, but also it means more candidates. But I think it does, it would lend to, keeping the baby boomers still working, because if they retire completely, it does shut that talent pool out. But if we can keep those doors open for maybe another 10 years and maybe they work 20 hours a week, then that will definitely help with our shortages.
Right. So you just mentioned 10 years. I was just thinking, any other predictions you have 10 years from now of what things might look like?
Yeah, so I think it could be completely different. I think you're seeing more telehealth opportunities for our nurses, where you're, rolling in a nurse to do a consultation, or you're being able to see a doctor from home. I mean, we already have this technology, I jokingly call, the Jetson Health, right? Mm-hmm. Where you can just pull up a doctor on your screen. That is here today and available, but I think it will become more widespread and the new norm of just being able to, if a child is sick or you're not feeling well, you can get online and be able to talk with a doctor or nurse and get your prescription sent to you. You can then have it delivered to you from Instacart or whatever service you use. So I think telehealth will be completely different. It will become our new norm. So I think that will create a lot of opportunities and attract more people to the industry if they would like that opportunity to work from home. I also think it opens up the door for more rural areas to get the best quality care available because they may not be available in that local market. But if they had the world of experts at their fingertips on a phone or a computer to be able to access, what a wonderful opportunity for them.
Agreed. And especially now with some of the waivers and reimbursements being extended for telehealth, maybe it gives a little bit more, confidence that things like shifting sites of care, hospital at home, and all the methods that you just talked about, people really, engaging and changing the actual infrastructure to be able to sustain that. So I'm looking forward to that too. Cathy, what have we not talked about that you might be interested to share with our listeners?
Wow, that's a great question. I think about, I think healthcare is one of the most important industries. Of course, I'm biased, but we do have to think about it as a nation and make sure that we are taking care of our baby boomers that are retiring, and we have to challenge ourselves to be more literate in technology and being comfortable with that and be comfortable with change. I think the hardest part of any of the initiatives that we want to start or change is just getting people to change faster and be more agile. And in healthcare, that's just not been the norm. I think it's easy to do that if you're a Google or an Amazon company. I'm sure they probably change org structures and pay and the way they do things all the time. That's just their culture to think outside the box. And healthcare has been very rigid, but mainly by compliance and standards, which is definitely necessary. But we as an industry need to move faster with the technology and being comfortable with change management. If something doesn't work, then be willing to change that. And so that really goes to all levels. And so that's just something that's not necessarily talked about.
Mm-hmm. Yeah, very important. Thank you, Cathy. If people is there anything that you want to maybe promote about where people could learn more about you, or any other speaking engagements, or maybe about Advent, anything you'd like to sort of promote?
Sure. Well, we definitely, our website, adventhealth.com, we have a really robust career website, really talks about the different programs that we have. If you, are just getting started in college and you want to come work for us in a nurse tech type role, and get your education paid for as a nurse, we have great programs for that. We have other vocational type programs. So it's really robust to think about how could I get my career started in healthcare. And then we are frequently hosting events. And so we do have an events page. We're always out at our facilities hosting events. Many of our facilities do have a walk-in Wednesday. So every Wednesday we have 3 hours you can walk in, and there will be a hiring leader and a recruiter available to speak with you depending on your interests. So we look for those locations where those are. I definitely am out visiting different locations.
Excellent. Cathy, thank you so much. And listeners, thank you so much for joining us on Elevate Care, and we will see you next time. Thank you for joining us today on Elevate Care. If you found this episode valuable, please consider sharing it with a colleague and subscribing to our show on your favorite podcast platform. You can learn more about this episode and our show on our website at amnhealthcare.com, and follow us on social media to stay updated on new episodes and the ever-changing world of healthcare.